Maria Lopez Cruz felt a lump in her breast, but with no health coverage and little knowledge about breast cancer, she delayed going to the doctor.
El problema es que no había aseguranza y por eso no iba también y pues nunca me imaginé tener cáncer.
Latina women, their health oftentimes in the family unit comes secondary to the children and the husband and the household. And so they may be less inclined to take care of themselves, much less have the resources, being underinsured, uninsured, or not having transportation, or having fear of the system itself and some of the cultural things that are within the medical community.
Right there.
Latinas are more likely than non-Latinas to be diagnosed with late-stage breast cancer.
Hold your breath.
And the later a woman is
Good.
diagnosed, the lower her chances of surviving.
Women who are diagnosed with stage 1 or 2 breast cancer have a 95% 5-year survival. If it's caught in the later stages, either stage 3 or stage 4, that survival rate drops dramatically. So a woman diagnosed with stage 3 breast cancer has a 73% 5-year survival, and a woman diagnosed with stage 4 has a 23% 5-year survival.
The Latina initiative, Poder y Vida, or Power to Live project, aims to increase breast cancer screening and catch cancer in the early stages when it can be successfully treated.
Hola, buenas tardes, señora.
The first step is to raise awareness by sending trusted health workers or promotoras to community events and into homes. The initiative is also reaching women through a Spanish-language media campaign.
En asociación con Kaiser Permanente Noroeste.
5 months after finding the lump in her breast, Maria learned that through the Latina initiative, she was eligible for a free mammogram from Kaiser Permanente. So she went in for screening and was diagnosed with stage 3 cancer. It was especially difficult because her mom had recently died after having a stroke.
Al igual que cuando falleció mi madre, yo quería morir, pero pues yo pensé que a mí me hacía falta mi madre, yo les iba a hacer falta a mis hijos y nunca no quise pensar en el cáncer, sino qué hacer para combatirlo.
Right there. Relax your shoulder.
Along with the free mammograms, Kaiser is also donating millions of dollars in medical care for the women who are diagnosed with cancer. This care includes radiation, chemotherapy, surgery, doctor's appointments, and help navigating a complex medical system.
Sí, bueno.
Hi, Elvia. My name is Rhonda. I'm a nurse navigator with Kaiser.
Hola, buenas tardes. Estamos hablando de Kaiser Permanente.
And I'm calling today to talk to you about the results of your breast biopsy. So as a nurse navigator for the Latina initiative, my role starts with the pathology report that, in collaboration with the community health workers, I deliver to the patient, letting them know, yes, I'm sorry, you have breast cancer.
Me sentí triste. Pues no podía creer que yo tenía cáncer.
Latina women often think that if they get a breast cancer diagnosis, that it is a death sentence and that there's really no hope for them other than to be ready to die and give up. With the Latina initiative, we seek to change those perceptions.
Having that scar tissue.
Patient navigator Olga Gerberg meets all of the women with cancer. She attends appointments, explains medical terms, and offers emotional support.
There is so many other women around these communities and the world, then they really need the support and really can benefit from programs and organizations like the one that we are working with.
In fact, many more Kaiser Permanente patients will benefit because of the Latina initiative.
As an organization providing healthcare, we've seen that we had some disparities in terms of our ability to care for Hispanic women. And so we've been able to make changes, providing more educational information in Spanish, making sure that our call-in numbers, that we had Spanish language options for scheduling.
When Maria was diagnosed, she was asking, why did this happen to me? But through family support and the Latina initiative, she's now asking what she can do to help other women.
Pues para mí era más importante tener hijos que estudiaran, hacerlos personas de bien, y nunca me acordé de mí. Les pido a la gente que equilibre su vida, pero que presten atención en uno mismo también.
As Maria continues to recover, she hopes to encourage other Latinas to be screened for breast cancer. I'm Mary Sawyers.